Well, it's an honor to be here, and it's also an honor to follow my old Santa Fe buddy, Kenny Osabel. A few days ago, as I was preparing my remarks for this event, I called Kenny and I said, do you have any advice for me as I prepare my talk? And he said, as a matter of fact, Larry, I certainly do. I knew he would come through. And he said, as you give your talk, just remember, do not attempt to be smart, charming, or intelligent. Larry, just be yourself. Kenny, that's some of the best advice I've ever had, and I certainly will try. Well, I have to say that I come bearing good news. As Kenny has already told you, how's this for an ad? Odwalla, you can pay me later here. As Kenny has already told you, about 6 years ago, there were only 3 medical schools in the country that would have anything to do with the idea that spirituality had anything to do with human health. But the data that has accumulated since 6 years ago has been so compelling that now we have 60 medical schools of the 125 in the country that have developed formal courses committed to exploring these associations between spiritual practice, religious devotion, intercessory prayer, and health. And as recently as 6 months ago, 100 of the medical schools in this country, of the 125, had signed formal declarations of intent to develop these sorts of courses. The taboo in spirituality and medicine has been broken. In the next few moments, I want to tackle one of the most controversial and outrageous and challenging aspects of this whole movement, this idea behind intercessory prayer, prayer at a distance. The idea that you could have an empathic, compassionate, loving, prayerful thought for someone at a distance and that have some effect, in spite of the fact that that person might not even know you were experiencing that for them. Now, that a few years ago was considered outrageous. Now, what about this business of prayer? It's probably a good idea to attempt at least to define this term. If you don't define such a complex term as prayer, you can get into trouble real fast. Let me show you how. Here's a guy going down out in San Francisco Bay. He's drowning, and he shouts to his dog on the bank, "Lassie, get help." Now, Lassie be a good dog. Lassie gets help. It's the wrong kind, and Lassie, this man dies because he neglected to define his terms. I have looked at the world's literature, and I found another dramatic example of a miscommunication and a failure to define terms, which has created all sorts of mischief as a result. Here is Moses receiving the tablets from God. He was expecting other kinds of tablets, didn't get them, so this is another one of those failures to communicate because of failure to define one's terms. The problem that we have faced, folks, in trying to bring spirituality back into medicine is that we know up front that it's not possible for something like intercessory, distant, off-site prayer to work because we've said this. The brain's workings are what we call some mind or a consequence of its anatomy and its physiology and nothing more. This is the point of view that if you think you're having one of these spiritual, transcendent, metaphysical things, that's just a function of what the chemicals in the brain are doing, as Carl Sagan reminded us. Francis Crick, the Nobel Prize-winning co-discoverer of the structure of DNA, put it this way: a person's mental activities are entirely due to the behavior of the nerve cells, the glial cells, and the atoms, ions, and molecules that make them up and influence them. So, we know in advance that thoughts are equivalent to the brain. They cannot reach out in space and time and possibly make a difference. We know ahead of time that this stuff can't work. Doctors know. We know these things. The problem is that the data hasn't got the message. And something that never happens is that when these discussions about the nature of consciousness and its positioning in space and time are brought up for discussion, And when we talk about this connection or lack of it between consciousness in the brain and body, there is another competing point of view which is brushed aside and never acknowledged. Here it is. Professor John Searle, who is one of the most distinguished philosophers in the country, currently working in this area, says, at the present state of the investigation of consciousness, we don't know how it works, and we need to try all kinds of different ideas. And chiming in is Jerry Fodor, another distinguished philosopher in the mind-body area currently in America, who says, nobody has the slightest idea how anything material could be conscious. Nobody even knows what it would be like to have the slightest idea about how anything material could be conscious. So much for the philosophy of consciousness. So, going with the idea that consciousness might be able to do things that are unpredictable from the dogmatic assertions that have dogged us for most of this century, certain researchers have come forward and have begun to explore the potential operations of consciousness in the world outside the body. You people in California ought to pat yourself on the back because you've been partly responsible for some of these insights. I want to relate to you a study which was published last December in the Western Journal of Medicine, which goes to most of the physicians west of the Rocky Mountains. It was done in your city by Fred C. Shea, Dr. Elizabeth Targ at Cal Pacific Medical Center, which is one of the medical centers associated with UCSF School of Medicine. This study looked at the role of distant intercessory prayer to make a difference in the course of patients with advanced AIDS. I'm not talking about freshly, newly diagnosed early AIDS or even middle AIDS. I'm talking about severe AIDS. And they did this study twice. One of these studies looked at what they call distant healing, which is a cover word for prayer, to make a difference in these patients. In the unprayed for group, 40% of the people died. In the prayed for group, nobody died. They doubled the number of patients and ran the study all over again, and they looked in this rerun of the incidence of AIDS-related illnesses, things like pneumocystis pneumonia, meningitis, and the things that kill AIDS patients. It looked as if the prayed for group was receiving some sort of special advantage. They had fewer so-called AIDS-related illnesses. They had to go to the doctor and the hospital less. When they went into the hospital, they got out quicker. They had a higher level of mental health throughout the study period. And these researchers looked at something that's rarely looked at in these sorts of studies. They looked at whether or not the patient thought that they were in the prayed for or healing group, and they compared that belief with how they did clinically. There was no connection whatever between whether a person thought they were receiving distant healing or prayer and how they did clinically, which is crucial because it shows that you cannot explain the results of these sorts of experiments by saying, this is just the result of positive thinking or the placebo response. When I heard about this study that you folks out here in California were doing, I phoned Elizabeth Targ, and I think I know most of the researchers in this area in the country, and I confess that when I discovered she was using AIDS patients, my heart sank. And I told her over the phone, listen, Elizabeth, we don't even have good medical treatments for AIDS, and you're trying to cure AIDS with prayer, with distant healing? I said, why didn't you pick the flu as your study illness? And I will never forget her response to me. She said, Larry, you are such a weenie. She said, I thought you believed in this stuff. And she said, and I could see her shaking her finger at me over the other end of the phone. She said, AIDS is perfect. If we can make a difference in AIDS, then the skeptics and the cynics won't be able to come back and say, well, this is an illness which would have recovered on its own. The people would have gotten better anyway. This doesn't prove anything. If we can make a difference in AIDS, we've really got something here. And she said, besides that, there's something else you don't understand. Healers like a challenge. And so she was totally right, and I was completely wrong, and I had my comeuppance about that. One of the most high-profile studies in the country now is going on at Duke University School of Medicine. Put this on your radar screen. You're going to be hearing all sorts of information about this in the coming months. This is run by Dr. Mitchell Krukoff, who is the Director of Cardiovascular Laboratories at Duke Medical School, and his research associate, who is a registered nurse and nursing researcher, Suzanne Crater. And let me tell you, in all of these research studies looking at intercessory prayer and healing, there's a nurse behind the scenes. Let me briefly describe to you what this study looks like. This is, again, one of those randomized, double-blind, prospective, matched clinical things. And so if you went into Duke Medical Center's VA hospital for a heart catheterization or an angioplasty, coronary blood vessel dilating procedure, here's what would happen. You would get the option of being treated conventionally, or you would get the option of being treated conventionally plus being prayed for. Now, this is a double-blind study. You wouldn't know which group you were in. But if you wound up in the prayed-for group, you would find yourself receiving more prayer overnight than you've probably ever received in your life. They notify prayer groups around the globe to begin praying for you. And it comes as a virtual shock for these North Carolina patients later to learn about some of the people who were actually praying for them. For example, they notify via email a Buddhist monastery in Nepal to gear up. They notified Nalanda Monastery in Western France to begin to pray. There's a free intercessory prayer website called virtual.jerusalem, which begins to pray for them. What they do, when they get the notification of the patient's first name, they write it on a piece of paper, they give it to a runner who goes over and folds up the piece of paper and slips it into one of those cracks in those boulders, those stones, in the Western Wailing Wall in Jerusalem. That is said to give your prayer a special advantage. And also they notify the Silent Unity prayer group out of Unity Village, Missouri, which is part of the Unity Church. And they also notify many different Protestant, conservative, I almost said right-wing, churches in the North Carolina area to begin also to pray for those patients. And one of the most interesting groups that devotes prayer for these Duke patients is a group of Carmelite nuns out in a convent outside Baltimore. And these nuns just adore praying for these heart patients. The study took so long to get going that at one point these nuns called up Dr. Krukoff and said, "Listen, can you hurry this sucker up? Some of us are getting old, and we do not want to miss out on the opportunity to pray for your patients." The early data shows this. If patients receive prayer, they have a 50 to 100% fewer side effects than people who are just treated conventionally in these invasive cardiac procedures. This is what we in this business call big data. This study was presented to the American Heart Association's annual meeting last December. It went down very cordially. So cordially, in fact, that this study has been expanded to 5 other hospitals around the United States. I could tell you study after study, not just in cardiovascular disease, but many other diseases. Some of you physicians might want to pay attention to the October 25th issue. It's just come out of the Archives of Internal Medicine. And this has a study looking at the effect of intercessory prayer in over 1,000 heart patients at St. Luke's Hospital, the Mid-America Heart Institute, in Kansas City, Missouri. This is affiliated with the University of Kansas School of Medicine, University of Missouri School of Medicine. The lead investigator is Dr. William Harris. So my point to you is this. These studies have jumped through all of the hoops that constitute legitimate science. And there is no way that I can see that this is going to go away. We are literally riding a tidal wave of evidence favoring what I call the non-local expressions of consciousness. And they just do not have to do, folks, with distant intercessory prayer or actively tweaking the universe out there. They have also to do with the ability of the mind to function non-locally, to acquire information from out there at a distance and even outside the present moment, and bring this information back to us in ways that allow us to make intelligent decisions about our health. Let me give you one example where this field is headed. There was a study done at the Southwest SIDS Center outside of Houston, Texas, a while back, and this looked at sudden infant death syndrome, SIDS, where the baby is found dead the next morning in the crib for no obvious reason, right? And so the SIDS researchers asked the parents of these babies who had actually died, did you ever have a hunch or a premonition or a dream that was so vivid that your child was going to die that you took this concern to your doctor and you made a big deal out of it? 21% of these people said, yes, we knew our baby was going to die, and we told the doctor and we made an issue of it. Then the researchers asked, well, do parents just normally go around having these kinds of fears and anxieties? So they asked parents of normal babies, have you ever had this feeling? Only 2.1% of them said yes. Here's what happened. When the parents took the concerns to the pediatrician and said, our baby is going to die, we know it, we've got to do something, in every case, there was no exception to this. In every case, the doctor responded to the parents with what the researchers called placating denial, ridicule, or outrage. And in no instance were they willing to take any further precautions, such as monitoring these babies. Had they had a worldview of the nature of consciousness that would permit the non-local acquisition of information that we've been talking about here, some of those babies would be alive. So when we talk about the non-local manifestations of consciousness, its ability to function outside space and time, to escape the confines of the brain and the body, we are not talking about cute little Victorian parlor tricks, such as telepathy and clairvoyance and that sort of thing. We're talking about life and death issues here. I had a patient to show up in my office in Dallas. She stuck her head in the office without an appointment one morning, and she said, I am terrified. I'm scared to death. You've got to help me. She said, last night I had a dream in which I saw 3 little white spots on my left ovary, and I'm terrified this may indicate cancer. We did an examination. It was normal. So then I took her back to the radiologist, and I said, let's get a sonogram. Let's get a picture of this. This patient made the mistake of telling the radiologist about her dream. The radiologist was not exactly into dreams. He put her down. She had her revenge, however, because the radiologist was back in my office about 15 minutes later, pale as a ghost, and I said, what's wrong with you? He said, well, the sonogram showed 3 little white spots on her left ovary, exactly as she dreamt, and they were benign cysts, and they were not cancer. This woman was able to acquire exceedingly specific information that could have made the difference in life and death. So what do you want to do with these things? You want to call them little patient stories, just anecdotes? Well, they're patient stories, okay. In medicine, there are 2 ways we deal with patient stories. If you don't like it, you call it an anecdote. If you like it, you call it a case history. In one dream, a nurse came to a woman in the dream, and the nurse was carrying a light, a lamp. And the nurse was shining the lamp to her left lower leg as if to illuminate, to show her something. This went on for a year. The woman couldn't make head nor tails of this until a year later, she erupted in a site of painful osteomyelitis, bone infection, at the specific site where the woman in the dream was holding the light. This is the iconic archetypal image of Florence Nightingale, the nurse with the lamp. And having mentioned Nightingale, I want to put in a shameless advertisement for my wife Barbara's book, which is being shipped to the bookstores this week, Florence Nightingale, Mystic Visionary Healer. This will likely become the definitive work on Nightingale for all of you nurses and people who want to read about one of the great women in the history of healing. It was really subtle the way I slipped the family ad in, wasn't it? Yeah. Well, I know that this has been a long session, and I'm going to cut some of this short. Okay, so how does it work? Most people currently in medical science who pay attention to these non-local manifestations of consciousness are stuck in a classical mechanical image about how they think this stuff works. You know, there are 2 people, the receiver, and let's say distant healing, the receiver and the healer. So most people think there's got to be some sort of mechanical, energetic connection between them. Listen, this doesn't work. we're going to have to overcome these classical images that there's some sort of signal between these two people that's somehow accountable by classical manifestations of energy. And some people have this idea that the stuff goes somewhere. You know, there's directionality to it because something is flowing in one direction or another. These images are hopelessly flawed. I think that the image that is going to carry the day is going to be one that is genuinely non-local, which overcomes the idea that anything is sent. If you try to interpret the data in terms of the old images of classical physics, it just isn't going to work. We are moving toward a non-local conceptualization of consciousness if we're going to be able to integrate and explain the sorts of manifestations we've been talking about. There are certain characteristics of a consciousness that borrows a non-local flavor, among which are these: infinitude in space, that is to say, omnipresence, and infinitude also in time, because you can't have infinitude in space without having infinitude in time. And so a quality of the consciousness that is non-local, as we see in these experiments, is indirect evidence for something that genuinely resembles the idea of the soul, something that is immortal and eternal and omnipresent. And so the spiritual connotations of a non-local theory of consciousness, I believe, are relatively profound. Skeptics say, we know the data couldn't be right because you don't have any theories to support them. Wrong. We are drowning in hypotheses and theories that account for this sort of thing. If you would like to review some of these things, these are some of the candidate theories you can chew on. All of these theories, some being advanced by Nobel Prize winners such as Brian Josephson, all of them have this non-local flavor in which consciousness is freed from the confines of the brain and body and also from the confines of the present moment. It is said by cynics and skeptics that good scientists don't play this game. Good scientists don't go there. You know, concern with this spiritual thing just confuses your thinking. That is a piece of stereotypical nonsense that needs to be discarded. There was a survey that was done recently and published in Nature, one of the prestigious science journals in this world, that found that 40% of American biologists, mathematicians, and physicists do believe in a supreme being who would respond to this distant intercessory prayer stuff. How's your boggle threshold doing? I love this. I know, this is preaching to the choir. You know, the boggle threshold is that level in your mind where you become so antagonized by an idea that you just shut off, and after that, the data doesn't matter. There is something about this field, this spirituality, this non-locality of consciousness that makes scientists and doctors go ballistic. And this is a strange thing. And I mention this because if you deal with this in your private life or with your physician or in your community, you're going to bump into this. So I just want to let you know a little bit about how this works. Ray Hyman is the dean of skeptics and cynics and critics in the country now toward this sort of business. He's a University of Oregon psychologist. Hyman says the level of debate during the past 130 years has been an embarrassment for anyone who would like to believe that scholars and scientists adhere to standards of rationality and fair play. He's right. For example, this actually got printed in the most prestigious science journal in the world. This is what I'm talking about. Not 1,000 experiments with 10 million trials and by 100 separate investigators giving total odds against chance of 1,000th to 1 could make me accept ESP. If I believe this, I wouldn't be stating it publicly. One looks for a term to dignify these kinds of stances. The best one I can come up with is bigotry. There you are. Hermann von Helmholtz, the most prominent physicist of the last century, said, "I can't believe it. Neither the testimony of all the fellows of the Royal Society nor even the evidence of my own senses would lead me to believe in the transmission of thought from one person to another independently of the recognized channels of sensation. It is clearly impossible." That inhibits dialogue. Here's my favorite. This is the sort of thing I wouldn't believe even if it were true. You got the picture? You might as well get ready for this. This led Einstein to say it's harder to crack a prejudice than an atom. But in spite of this, let me tell you, the skeptics and the cynics are on the run. Our best scholars are at our medical schools. And the only reason these scholars have taken on this database, and the only reason why 60 medical schools currently have courses in this stuff, is because of the evidence, because of the data. We're getting there. Let me tell you, Carl Sagan was no fan for what we've been talking about, but at least Carl got this right. In his UCLA commencement speech in 1991, he said, "It is the responsibility of scientists never to suppress knowledge, no matter how awkward that knowledge is, no matter how it may bother those in power. We are not smart enough to decide which pieces of knowledge are permissible and which are not." Go, Carl. Now, this is a group I recently gave a presentation to about these ideas. And now, if you get interested in this area and you want to carry these ideas into your hospital or clinic in your community, and there are a lot of community-based initiatives going on out there to actually do this, you may run into some responses which make you say, "My environment is too hostile. I cannot pull this off in my community." Well, there's some lessons I think we could learn from some of my favorite animals on Earth, the emperor penguins who live in Antarctica. And if you think the community you live in is hostile, these comparisons are really subtle, aren't they? You look at the hostility of the environment that they live. They live in the most hostile environment on Earth, but yet they raise these, they raise these little downy, furry, helpless little creatures in spite of the hostility. And this is what happens sometimes. This is how hostile it gets. The winds sometimes blow 100 miles an hour and the temp plummets to 100 below. And so this is what they manage to endure, and they come out okay because here's what they do. They form circles. They come together. Do you get the metaphor here? They form support groups. They build community. Right. And here's what happens. Here's what happens. When the wind blows and the temps plummet, they form these circles, and one of those penguins on the outside of the circle stays out there as long as he or she can endure, and then the circle opens up and admits that bird back in, and somebody goes out and takes his or her place. And ethologists have worked this out with great precision. Because they have this dance, they lower their heat loss in this hostile environment by 30%. And if they did not do this cooperative thing, all of these birds would die. And it is only because they help each other out that they manage to survive and thrive. And they do okay. Oh. And while you do this, since we're talking about spirituality, don't forget to pray, as we see in these penguin prayer meetings. Mark Twain, be careful reading books about health. You might die of a misprint. There's a way to avoid dying of a misprint. There's a great, fabulous, compelling, inspiring, thorough, luminous book that has just been published. It's available in the bookstore called Reinventing Medicine. I wrote it. Thank you. Also, if you want to pay attention to a peer-reviewed scientific journal that doesn't miss much of the stuff that Kenny talked about in his presentation about alternative medicine, and which will help you track what's happening in the spirituality and medicine debate, let me recommend this. The title is off the slide. Alternative Medicine. Excuse me, I don't even know the name of my own journal. Alternative Therapies. Alternative Therapies in Health and Medicine. This is a peer-reviewed journal. It's the most subscribed to journal in its field in the world. I'm the executive editor, therefore I have a personal interest in it. If you want an 800 number, here's one, 800-899-1712. Website, alttherapy.com. alttherapy.com. Got it? 2 T's or 1? I don't know. 2 T's. Yeah, 2 T's. In seriousness, I want to conclude by expressing my sense of urgency about this. I think those who believe in the spirituality and medicine movement need to get high behind and do some work in our own communities to help this flourish and take a stand, move to the outside of the circle. I happen not to believe that time is on our side here. And I agree with Whitehead, who said, "It is no exaggeration to say that the future course of history depends on the decision of this generation as to the relations between science and religion." And I find myself also in agreement with the great French novelist André Malraux, who happened to say, "The 21st century will be spiritual, or it will not be at all." Thank you very much. Thank you.